This is a CJASON podcast, and I'm Rashida Hall, a nephrologist at the Durham VA Medical Center and Duke University. On behalf of my co-authors, I'm here to talk about our research paper, Choice of Hemodialysis Access in Older Adults, a Cost-Effectiveness Analysis. In this study, we evaluated costs and outcomes after placement of hemodialysis access to understand how age and life expectancy may influence the cost-effectiveness of a fistula placement. Fistula have been endorsed as the preferred and most cost-effective form of hemodialysis access, based on their lower mortality and complication rates compared with grafts and central venous catheters. However, there is growing concern that the relative benefits of fistula over other access types are lower in older adults who more commonly experience problems with failure of fistula to mature or be patent. Also, the benefit of fistula placement is questioned because the time required before fistula can be used may exceed an individual's life expectancy. While life expectancy generally decreases with age, there is substantial heterogeneity in life expectancy among older adults of similar ages due to heterogeneity in functional status and burden of comorbidity. Given this heterogeneity, our study was designed to determine if fistula placement is cost-effective across the range of life expectancies in older adults initiating hemodialysis. For this study, our cost-effectiveness analysis involved a hypothetical cohort of incident hemodialysis patients with catheters who would choose one of three treatment options: 1. Fistula placement, 2. Graft placement, or 3. Continued catheter use. We designed Markov models for each of those treatment options. Each model accounted for clinical events on a monthly basis, including access maturation, access complications such as infection or loss of patency, and death. Cost, utilities, and probabilities of those events were incorporated into the models with data obtained from existing literature. We performed Monte Carlo simulations to evaluate costs from a healthcare system perspective and effectiveness for each treatment option over a 5-year time horizon. This simulation process was performed for each of 5 age groups: 65 to 69, 70 to 74, 75 to 79, 80 to 84, and 85 to 89 years of age. Within each age group by 3 life expectancy quartiles: sickest, average health, and healthiest. This approach allowed us to examine 15 age and life expectancy subgroups and compare incremental cost-effectiveness ratios between fistula placement and graft placement or catheter use for each subgroup. When we compare fistula placement to continued catheter use, the fistula option was cost-effective for all age and life expectancy groups except for 85 to 89-year-olds in the lowest life expectancy quartile. When compared to graft placement, the fistula option was more cost-effective for all quartiles of life expectancy among the 65 to 69 age group. However, in older individuals, the fistula option tended to only be cost-effective in patients with life expectancy greater than 2 years. For groups for whom the fistula option was not cost-saving, the cost to gain 1 quality-adjusted life month, or 1 month of life in perfect health, ranged from $2,294 to $14,042. Overall, these data show that the cost-effectiveness of fistula placed within the first month of dialysis decreases with increasing age and lower life expectancy. If we take a health system perspective and consider the allocation of resources, these data suggest that graft placement, and in some instances even continued catheter use, would not yield significantly greater cost to a healthcare system than fistula placement. However, cost effectiveness is not often the most important consideration when a nephrologist is choosing vascular access for an individual patient. So the implication of this study for clinical practice is that prognostication of survival, followed by a discussion about whether the benefits of fistula placement may or may not outweigh its potential harms, can enhance shared decision-making about hemodialysis access options. While there is room for additional research on vascular access outcomes in older adults, this study demonstrates that fistula are not the least expensive treatment option and do not provide the best quality adjusted survival for all older adults who are new to hemodialysis.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.